My name's Jolene and I'm from Australia. In the last 4 years, I've spent nearly $200,000 transforming from a male to a walking, talking Bratz doll.
That's cute.
That one's actually cute.
Yeah.
To achieve my goal, I need to have my nose fixed because my nose is way too large for my face and I just want it to be as close to a doll nose as possible.
That's cute.
Before I was Jolene, I was Joseph. I'd always watch Baywatch with my grandfather and identified with Pamela Anderson and not so much David Hasselhoff. And that's when I realized that I was born in the wrong body and needed to pursue becoming a woman. And then I became all of this. Ooh,
Oh, I love
one's good.
that. That is
so
everything.
cute. Ever since I started transitioning, I've had hormone replacement therapy and I've had about 15 surgeries, 6 nose jobs, my boobs done twice, my ears pinned back. When I was 16, I did forge my parents' signature so that I could get lip filler, and my lips did look like big swollen sausages, but I was totally obsessed with them. I got my first nose job because I was having sex with a guy in the back of his dad's Mercedes in the basement of the Luxor, and he was wearing a gold chain and it kept hitting me in the nose. I found out a week later that it had entirely fractured my nose and my septum, so I had to have it repaired. And while they were in there, I did ask them just to straighten it up a little bit, give me more of like a doll-looking nose. After I had my first nose job, my nose was still a little wider than I liked. So in the last 5 years, I've had 6 nose jobs in total. But I'm still not happy with my nose. I just feel like my nose looks like the head of a penis, and I do still want another nose job. I'm pretty confident Dr. Dubrow and Dr. Nassif will definitely be able to help me out. I'm a huge fan of Dr. Dubrow. He is one of my top celebrity crushes. If he's available, so am I. Are you ready to make some pudding?
What are you doing? Are you literally just making like the implant to see if it fits in your head?
Yeah, I guess I just have to make my own and see what kind of size I
We
need.
just have to do it ourselves
Yeah.
then.
Along with my nose job, I want 2 breast implants on the top of my head to give me that Bratz doll look, making my head look bigger at the top. I was just like thinking the other day how annoying it is having to do my hair every single morning. I could be married by now if I like didn't have to do my hair every morning, like literally.
Oh my
You know.
God, you literally could.
Hopefully this is my last time in a kitchen.
Oh my God, I literally don't know how like women in the 60s did this.
What if I do this?
Oh my God, that's such a good idea.
Sometimes you just gotta hold it open to get it in.
Oh my God, this is
feels
harder than getting a
familiar.
man in there.
There we go, is it in?
It's in.
Every single day I put a bumper into my hair and I thought, what if we just have it in there permanently?
Oh my God, I'm so excited to see what this looks like. Like, look at that. I love
It's perfect.
that.
The implants on the top of my head and a smaller nose will definitely get me a little closer to my goal of looking like a doll.
You know how you're always talking about how your head's like smacking against the headboard when you're having
Like that
sex?
time I got knocked out.
Yeah, this is gonna be like a pillow protection.
God.
Oh my God, like 2
That is, like,
in
perfect.
1.
We have a patient who is transitioning. This is Jolene, and Jolene has done breast augmentation surgery. Looks pretty good, right?
Pretty good.
Yeah, and has concerns about her nose.
Okay.
So why don't we see if we can help her, okay?
Sure. Can you please send in Jolene?
Hola! I hope you fellas like chicken because I'm serving breasts and legs today.
Whoa, hello.
That's good.
Hi, lovely to meet you.
Nice to meet you.
Hey, I'm Olivia. Nice to meet you.
Nice to meet you.
Interesting outfit.
Oh, thank you. I
Yes.
picked it myself.
By the way, do you have a little sticky there to make sure it doesn't open up?
I sure do. I can get rid of it though if you like.
Well, you are sassy.
I try to be. I'm pretty convinced that Dr. Dubrow likes my outfit, but whether he can help me out or not, I don't know.
So are you Australian?
I sure am.
What is it, a 15-hour flight from here, right?
I think it's a little longer than that.
16?
No, I think 16 coming back, yeah. My favorite Australian word is no.
No?
No.
Not no. Nar. Nar.
No. How do you say it?
We say no.
No.
No. No?
No.
No.
No?
No.
No?
No.
I really can't hear the difference.
Okay, so we want to know about the journey. Tell us about how that process started.
Yeah, well, I think it all started when I was around 9, 10. The Bratz doll show came out, and I just thought that was so cool. That inspired me so much. I wanted more of like a doll look. So around 18, 19, I started to feel like how I was feeling wasn't how every other gay man was feeling. So got on HRT, and I was in and out of surgery, getting my nose done, getting my face done, and just the more and more I did it, the happier I got, and I haven't looked back at all.
Interesting. So how many nasal surgeries have you had?
I have had 6 total. I would like more like a doll nose. Closer to the face from the profile.
Okay, so
a tight
deprojected.
little tip.
And with no breathing.
I'm okay with that.
A big issue between a doll's nose and a human's nose is that dolls don't really need to breathe. We do. Dolls are to be used to play with, not to be used as an inspiration for body modification.
How much have you paid so far for all of your surgical procedures?
200,000. I would like to cap it at $1 million.
How much more could you possibly have?
Good question. So a few things I want is a trachea shave, a brow bone shave. I would like my jaw shaved. I definitely 100% without a doubt need an implant in my head. So it would be 2 breast implants on my head, like 2 boobs.
I often have patients that want bigger breasts, but not more of them.
I feel like it would definitely help in the dating department to have more boobs.
You must attract an interesting variety of men, correct?
Yeah, I definitely prefer men with 8 figures and 10 inches.
So obviously you know there's certain things that we won't do. What are you coming out here to see us both for?
I definitely want you to check out my nose, also my head, because I'm always bumping my hair and it just takes so long and I just don't need that added labor.
I think without further ado, we should go to the exam room and have a look and see if we can help you, okay?
Party.
Let's go do that.
All right, let's do that.
I noticed that this isn't exactly an Egyptian.
Oh, you brought your own.
Yeah, I
Oh,
sure
look at that.
did.
Come prepared. So looking at your nose, it's pretty narrow up here. They sure broke your bones in one of those 6 surgeries. So now looking just at your tip, I want you to take the Q-tip and tell me exactly what you'd want.
Maybe like just bring this in.
Breathe for me. Keep breathing like that for about a good 30 seconds. Tell me how you like it. You want to do that to your nose.
Uh-huh.
Now that's damaging or deforming a nose. I don't do that. I usually reverse that. The Bratz doll's nose is pretty much non-existent. It looks like a little slope, but it's so small, it looks like pretty much have a no-nose. It's just not gonna fit. It's not gonna work. Hey, I got a question about your scalp. What's underneath there right now?
It's like a little cushion.
Can I touch it?
Yeah, of course.
So that's what you want to put the implant?
Oh, look at that. Boing, boing, boing.
It protects
Protection.
my head against the headboard.
The headboard.
Banging of the
Boing,
headboard?
boing.
Okay, I get
that's
that.
good. You might lose all that beautiful hair of yours, though, if you put a expander in the back of your scalp. This also is a mistake.
Yeah. I'm so happy that there are certain procedures that are designed to take you to the next level, the bone shaving, the jawline refinement. But don't be a pioneer testing the limits of surgery that could kill you. You
That's
buying
fair.
that? That's fair, right?
I think it's a lot to consider.
I like your nose. I think you have a nice
There you
nose.
go, there we go. Do we think some of the things we said are dangerous?
I guess if you say they're dangerous, then that's probably true because you're like a doctor. But I
Okay,
don't
that-
care what she does because it's whatever she wants to do.
I hope we don't see you back in this exam chair because you damaged yourself here.
So, pleasure meeting you.
Me too.
Take care.
I don't think I'm gonna take all of Dr. Dubrow and Dr. Nassif's advice, but I am totally obsessed with them. I don't think they were expecting to get so much personality in the office today. I definitely will take a bit more time
Yeah,
looking at my options.
I think, you'll still definitely go ahead with a few of the things, but at least, yeah, you've got more
Yeah.
information now.
Yeah.